I went for a routine checkup with my doctor, and a dark spot was noticed in the back of my throat. And I was sent to a specialist to get a biopsy because my doctor couldn't understand. He had never seen it before.
A good friend of ours had passed away. I was stunned that he had gotten prostate cancer at the age of 54. I picked up the phone and called to get a physical.
Something didn't seem right. Just like, how can I gain so much weight so fast? We just kept going to the doctor, and then finally they found something in my ovary.
A couple days later, I got that call. I found out that I had high-risk prostate cancer.
That moment, you think about your family. I thought about my girls. And I just kept on thinking, I'm not done. But I'm not done.
There was no other doctor in that hospital that had treated my type of cancer. At this time, we weren't with UCSD. And they told us that it was uncertain if we would be able to have babies. So we went out of network, and it took just that one visit to have complete faith.
The doctor that I had went to, the specialist, he said, we don't feel confident to treat you here, but I'm going to send you somewhere where we feel that they could take care of you. And he said, you're going to go to the UCSD Morse Cancer Center.
At the heart of it, everyone who's a physician, the reason you do this is people, making a connection with them, trying to understand, what they're going through, and as best we can. That's the reward, is helping somebody through what's probably going to be one of the, if not the toughest time in their lives.
We get a chance to know our patients and our patients' families really for the rest of their lives. So it's nice to really maintain long-term relationship with patients and families, and also work as a team with other healthcare professionals to take care of people.
Here at Moore's Cancer Center, a distinct feature is the collaborative nature at all levels. Surgeons, radiation therapists, basic scientists. We are recruiting the very best minds in the field. We're building the infrastructure and adding programs that we need to bring the latest science to our patients. We are one of the leading cancer centers in the country.
I went from no hope to hopeful. So I knew that what was humanly possible to help me to sustain this treatment was being done. And I couldn't let them down because they were all rooting for me. They were all behind me.
When you walk out the door from where you get radiation, there's a bell on the wall. In the 39 days that I had treatment, I was fortunate enough to hear the bell ring about 4 or 5 times. And you don't really think about it the first time or the second time, but then you start going, oh my God, I'm gonna ring the bell. On day 39, it's gonna be my turn. It was over. Felt great.
I mean, Juliana, she's a blessing. She's what we call our miracle baby. I don't even know what words to describe what I felt. I'm just still in awe that she's here.
Such a thrilling time to be in medicine, especially to be in a great research institution like this, because it really is making a difference for individual patients and, of course, for our community. San Diego is impacted in such a positive way by having the Moore's Cancer Center here.
Before I would go into hospitals and I would see names of people that had donated money to get it started, and it never really meant anything to me because I wasn't affected by it. But now I see how important it is for those wonderful donors that are so generous in helping people like me that would not have this opportunity.
In order to make the big leaps forward, in order to take the high-risk projects, the ones that will yield those transformative changes, we need support from people who are interested in applying resources to the types of projects that we know will make a dramatic difference in the future, but may not necessarily be funded by the current existing entities.
We have to remember that the reason we're all here is to treat patients and to do everything we can to help patients and families get through this and to ultimately to cure this cancer. We are truly all in this fight together, and together we will win. I know it.